My name is Dr. Walker. I'm an opioid addiction specialist at suboxoneclinics.com. Suboxone Clinics is one of the biggest opioid addiction clinics in the United States. Let's talk about opioid treatment programs, methadone versus buprenorphine. Opioid Treatment Programs, OTPs, are designed to help individuals struggling with opioid addiction by providing medication-assisted treatment, MAT, alongside counseling and therapy. Two common medications used in OTPs are methadone and buprenorphine. Both of these medications are used to manage opioid withdrawal symptoms and cravings, allowing individuals to stabilize their lives and work towards recovery. However, they have some differences in terms of how they work and their usage. Methadone, full agonist. Methadone is a full opioid agonist, which means it activates the opioid receptors in the brain similarly to other opioids like heroin or oxycodone. Long half-life. Methadone has a relatively long half-life, which means it stays in the body for an extended period. This allows for once-daily dosing in most cases. Supervised administration. Typically, methadone is administered in a clinical setting, where patients are observed taking their dose to prevent diversion or misuse. Regulated. Methadone is a tightly regulated medication, and its distribution is usually controlled by federal and state regulations. Higher risk. Due to its full agonist nature, methadone carries a higher risk of overdose if taken inappropriately or in combination with other substances. Effective for severe addiction, methadone is often recommended for individuals with a history of severe opioid addiction. Buprenorphine, partial agonist. Buprenorphine is a partial opioid agonist, which means it activates the opioid receptors to a lesser extent compared to full agonists like methadone or heroin. Partial antagonist. Buprenorphine also acts as a partial antagonist, which means that it can block the effects of other opioids if taken in sufficient doses. Long half-life. Buprenorphine has a relatively long half-life, allowing for less frequent dosing than some other opioids. Prescription in office-based settings. Buprenorphine can be prescribed by qualified healthcare providers in an office-based setting, which provides more flexibility for patients. Lower risk. Due to its partial agonist nature, buprenorphine has a lower risk of overdose and respiratory depression compared to full agonists. Effective for moderate addiction. Buprenorphine is often used as a first-line treatment for individuals with moderate opioid addiction. The choice between methadone and buprenorphine depends on various factors, including the severity of addiction, individual patient characteristics, and treatment goals. Both medications have shown effectiveness in reducing cravings, preventing withdrawal symptoms, and helping individuals maintain stable lives while working on their recovery. It's important for medical professionals to assess each patient's unique situation and tailor the treatment approach accordingly. For updates on opioid addiction recovery topics, please subscribe to our channel. To make an appointment, please schedule on Suboxone Clinic.